Hello, my name is Lilian Bern. I'm a holistic therapist. I've been in practice for nearly 40 years. What I'm here to tell you today, to begin with, is bad news. We don't have a healthcare system, even though we're calling it that. Do you know what we have? We have a sick care system. In this country, we have one of the highest rates of chronic illness in the whole world. In this country, we have such an overuse of medication and drugs that we use more than any other country. And we have a higher rate of toxicity in people as a result of this. We have an obesity epidemic, adults and children. So what we do in this system, the one we've had for a number of years, is identify and name illness and then treat it. And the most common ways of treating it is either with medication and drugs or with surgery. But what we're treating is the symptom of the illness. We're not treating the cause of the illness. Even the so-called preventive medicine that we have uses high technology, high cost, invasive procedures to find illness in people. Then what happens is we declare war on the illness. And then what happens is that it usually gets worse or magnifies. Our so-called healthcare system is the most expensive in the entire world. And yes, it extends life. It does that. Does it extend a high-quality life? Not usually, because of the chronic illness. So, it doesn't provide a good quality of life. It does not create what we would consider true health and wellness. If my memory serves me right, the average per capita insurance rate currently is about $5,000 a year. And this is for sick care. And it does not cover the cost of treatments. That's pretty expensive. So, here's the question. Goes back to the debate, but you have different information perhaps. Do we need any more of this? No, I really don't think so. What we need is true health care. What's that? Number one, we need to teach people, adults and children, how to create and maintain health. Mentally, emotionally, relationally, physically. Because all those aspects count. And all those aspects work together. That's a holistic approach. We need to know how to create it, how to maintain it. Number two, we need to totally change what we call the typical American diet. Genetically modified foods, chemically treated foods, foods that are prepackaged and pre-cooked, fast foods, the inclusion of sugar and corn syrup in nearly everything, and even those traditional 4 food groups in a pyramid that we've had for years and years. Unfortunately, all of that creates illness. It does not create health. Now, health insurance would need to cover for the education of the public in step 1 and step 2, so that we learn about creating health and the connection of mind, body, spirit, and emotions, and so that we totally eat differently. But health insurance also needs to cover other services besides medical services. What I'm talking about is covering and paying for alternative health services that are non-medical, non-drug. They're wellness and healing modalities. And I'm going to give you a list that doesn't cover them all. Acupuncture, meditation, massage, stress relief, family therapy, trauma therapy, belief change therapy, detoxifying and cleansing the internal aspects of our organism. I think I forgot to mention trauma therapy, which is so pervasive. Most people are traumatized. Also, hands-on healing techniques and energy healing. If all these modalities were covered, people would visit doctors less. Don't know how receptive the medical model would be to this, but would have certainly promote health. So health practitioners and the public need to be re-educated to find the causes of illness or disease or feeling bad. There are several causes that come together always. And then, by removing the causes, we would heal. Rather than what we're doing now, which is treating the symptoms with too many medications and very costly interventions. In a much broader scale, not just in this country, but we need to create a culture of peace, a culture of harmony, and reconnect with nature. And love nature, love the earth. If we were to make that change, we could so much create healthy people in a healthy environment of well-being. If we allocate some of our current average insurance premiums to cover all these additional services that I'm proposing, and if we reduce and limit drugs, surgeries, invasive tests, and heroic measures to extend life beyond or close to the end of life, I believe that in 10 years, the American population will be much healthier, much happier than what we have now. And, therefore, we will cut the costs of sick care in half. Now, of course, this is my belief. I can't prove that. But I really think that's the way it would go. If what you have heard makes sense to you, write to your senator. Write to other politicians that you know. Have your friends watch this video. Have them contact people of influence that they know. Send a copy of the video to the public media. In fact, write to your insurance company and tell them you want these additional services. And we can create the change that this country is desperately needing. If you would like more information on myself, Lilian Bern, or on holistic therapy, or in general a holistic approach to living and healing, check out my website, lilianbernholistictherapy.com. And thank you very much for listening.